part.
There's someone on the road.
What?
There's someone on the road.
No, no.
There.
So
15 minutes.
Oh, okay.
Okay?
some of them are at Haddad office.
Okay, it's not a problem. After 1 week, one session,
والله هذا يستشكل لك
I will tell about spinal cord. Spinal cord is a part of the central nervous system. Okay? It's a part of the central nervous system. You imagine a 27-year-old man after car accident has damage in the vertebral column. Okay? After this car accident, this patient has loss of pain and temperature in the right lower extremity, right lower limb, and loss of discriminative touch and vibration on the right lower limb, and loss of motor function in the right lower limb. Is it clear?
Yes.
Okay. What do you think about this patient based on this complaint? Can you tell me which part of the vertebral column and which part of the spinal cord has damage?
The lumbar region
Lumbar region of
of vertebral column.
vertebral column. This damage is unilateral or bilateral?
bilateral.
Why?
Because it's damage on both sides.
I think it's unilateral.
Okay. In this session, we will discuss about this patient and spinal cord. Okay? At the end of this session, you should tell me which part of the vertebral column and which part of the spinal cord has damage. Okay? And this damage is unilateral or bilateral. I will tell you this damage is unilateral. But in the right side or left side,
Right side.
your patient has loss of pain and temperature on the left side and discriminative touch and vibration
On the right side.
on the right side and motor dysfunction
On
in
the
the
right side.
right side. Okay? You should tell me this damage is on the right side or left side. What's the meaning of pain? Do you know?
And the feeling of discomfort.
البطرة ديالها ليه؟
So the
What's the pain?
Pain? Feeling of hot or something like that.
What's the pain?
Bas from the gum. Feeling something hurt on the floor. Nerve.
You. What's the pain?
A sensation mechanism for defense.
Is it good or bad?
Good.
Good.
Good?
Yes.
Good?
Yes, very.
Because we will protect the body.
It will tell you that you have something paining you.
If it's too much, then it's bad. If it's
Okay, okay.
little, then
Do you have a needle? Do you have a needle?
السماكة؟
No?
السماكة؟
Do you have? No, needle.
It's the same.
I said both.
Close your eyes. Close your eyes. Don't worry. Okay? This is the needle. Yeah? This needle then goes to the index finger of, what's your name? Haydar. Haydar, okay? Makes pain. Haydar knows there is a dangerous condition. Yeah? Pain is an alarm in the human body. When I ask you, when is the beginning of the medicine, you answer me from beginning of the pain sensation. Okay? And when is pain sensation in the human? From creation of the human. Okay? History of medicine goes to creation of the human. Because pain is a part of the human feeling. Okay? There are two types of pains. If I needling finger of the Haydar, this pain from here goes to the spinal cord. And the spinal cord, after crossing on the other side, this is left hand. Yeah? This pain goes to the left side of the spinal cord, and after crossing, goes to the right side of the spinal cord of the Haydar and ascend to the thalamus. Okay? And from thalamus, this pain goes to the cortex, right side cortex. He knows where is the sensation. Can he sense my finger? Yeah?
Yes.
Yes. This type of pain is sharp pain. Okay? Sharp pain. There is another type of pain. Slow pain, or dull pain, or distributed pain. Sharp pain conveys by myelinated fibers, and slow pain conveys by non-myelinated fibers, bare fibers. Is it clear?
Yes.
Okay? There are another classifications for the pain. One patient come to your office and tell you, I have pain in my chest and I have pain in the left shoulder and medial side of the left arm. What's this pain? This is heart pain. Angina pectoris. Heart pain. This heart pain refers to the left shoulder and medial surface of the left arm. This type of pain is called refer pain. Refer pain. Pain in the Farsi we tell dard. Alam. Dard raji'e. Refer pain. Dard raji'e. Dard raji'e. Refer pain. Okay? Refer pain. A patient with cholecystite or gallbladder stone has pain in the right upper quadrant of the abdomen, and this pain refers to the right shoulder. Okay? Refer pain are abnormal pain. For example, in some buildings, when you turn on this light, okay, this light, lamps or light of other room will be off, turned off. Is it normal? No. Refer pain is based on same or common origin of some nerves. For example, phrenic nerve has C3, C4, and C5 origins. Yeah? C3, C4, and C5. And supraclavicular nerve has two origins, C3 and C4. C3 and C4 between phrenic nerve and supraclavicular nerve is common. This origin is common. Is it clear? Another pain is phantom pain. Phantom means imaginary. Phantom pain. For example, after amputation of right leg in one patient tell to his family, I have a pain on the right foot. They tell, you don't have right foot, right leg. But patient tell, I have pain. Okay? I have sensation in the right foot. After removing the teeth, Okay? After removing a tooth, your patient maybe tell you, I have pain. Okay? This pain is phantom pain, imaginary pain. And another pain is chronic pain. Chronic pain, such as trigeminal neuralgia. Trigeminal neuralgia. Patient come to your office and tell you, I have pain in my face. Okay? I have pain. In some conditions, for trigeminal neuralgia, you should cut trigeminal nerve because your patient has chronic pain.
It will keep going.
Okay? Chronic pain. Interpretation of the pain in the males and females are different. Okay? Interpretation is different. Males interpret pain as a personality issue. Is it clear? Yeah? But females interpret as an emotional issue. Okay? So are differences between male and female brain. I told you spinal cord is a part of the central nervous system. Spinal cord is a cylindrical structure. That is located in the upper 2/3 of the vertebral canal. Upper 2/3 of the vertebral canal. Okay? Upper 2/3. Inferior part of the spinal cord is called conus medullaris. And conus medullaris is at the level of intervertebral disc between L1 and L2. L1 and L2. Okay? Inferior part of the spinal cord is called conus medullaris. This conus medullaris is conical structure. Conical structure. This is called conus medullaris. Conus medullaris in adults is at the level of intervertebral disc between L1 and L2, or inferior border of the L1. Is it clear?
Yes.
Okay? You see here, spinal cord, and this part is conus medullaris at the level of intervertebral disc between L1 and L2. In the inferior 1/3 of the vertebral canal, there are two structures. One structure is called filum terminalis, and second one is coda equina. Coda equina. Phylum terminal is a remaining of the pia matter. Pia matter is a loose connective tissue with many blood vessels that attach to the surface of the brain and spinal cord and inferior to the apex of the conus medullaris. This pia mater makes phylum terminal. Phylum terminal. And coda equina is nerves of the spinal cord or spinal nerves that descend in this area and make phylum, make coda equina. Is it clear?
So we have the layer around the spinal cord. It's called phylum terminals. That is extended from the cranium, that's mean from the peris to the end of the spinal cord, or just from the atlas to the end of the spinal cord. Is it starting from the peris link, and that's mean from the brain.
Meninges or coverings of the brain and spinal cord are same. Dura mater, arachnoid, and pia mater. Okay? Pia mater attached to the surface of the spinal cord and the brain. Okay?
That's mean the first layer, because we have 3 layers.
Outside is arachnoid and dura mater. Okay. There are dura mater and arachnoid around the brain and spinal cord. Okay? And when spinal nerves emerge from intervertebral foramina, these layers goes out and then make opening for emerging. Yeah.
Phylum terminalis is pia mater.
Yeah. Phylum terminalis is remaining of the pia mater. Okay? And coda equina is
The nerves.
spinal nerves. In the inferior one-third of the vertebral column. Is it clear? I told you the spinal cord is a cylindrical structure that extends from foramen magnum, the occipital bone, to the intervertebral disc between L1 and L2. And inferior part of the spinal cord is called conus medullaris. In the intrauterine life, in the 3rd month fetus, inferior part of the spinal cord is at the level of coccyx. At the level of coccyx.
That means to the end.
Yeah. Spinal cord fills whole length of the vertebral column. But growth of the vertebral column is faster than growth of the spinal cord. Okay? And at the birth, in the newborns, inferior part of the spinal cord is at the level of L3. And then growth of the vertebral column is faster than spinal cord. And in adults, inferior border of the spinal cord is at the level of intervertebral disc between L1 and L2. Is it clear?
Yes.
But when vertebral column grows inferiorly, pia mater attached to the coccyx. Okay? And this pia mater between conus medullaris and coccyx made phylum terminalis. Is it clear?
Yes.
Phylum terminalis. I told you spinal cord is a cylindrical structure. Is a cylindrical structure. But this cylindrical structure is not uniform. Superior part is larger and inferior part is smaller. And in the two sides there are enlargements. One enlargement is called cervical enlargement for innervation of upper limbs from C4 to T1 segments of the spinal cord. And another enlargement is lumbar enlargement for innervation of lower limbs from L1 to S3. From L1 to S3. Yeah, lumbar enlargements. You know that innervation of upper limb is by brachial plexus, and innervation of lower limbs is lumbar and sacral plexus. Yeah. If you remember, I told you there are 31 pairs of spinal nerves. Do you remember?
Yes.
31 pairs of spinal nerves. Spinal cord is a cylindrical structure, a uniform column, but we conventionally can divide the spinal cord to the 31 segments. Okay? This is a column. Okay? But based on location of spinal nerves, emerging sites of the spinal nerves, we can divide spinal cord to the 31 segments. Is it clear? Yeah? 8 segments in the cervical part. 8 segments in the cervical part. 12 segments in the thoracic part. 5 segments in the lumbar, and 5 segments in the sacral, and 1 segment in the coccygeal. Okay? How many vertebrae are there in the cervical part of the vertebral column? 7. 7 vertebrae. How many spinal cord segments are there in the
Cervical,
Eight.
cervical part?
8.
8. I told you each segment has one pair of spinal nerves. Can you tell me first cervical spinal nerve emerges from where?
Exhibition. Between the exhibition, this one, and the first one, atlas.
Between atlas or first cervical
And from there,
vertebra and occipital bone,
occipital bone.
superior to the atlas. Second cervical spinal nerve emerges between atlas and axis.
Axis,
And eighth one emerges between C7 and T1.
T1.
Okay? After this, each spinal nerve emerges inferior to the same number vertebra. Okay? If I ask you, where is the emerging side of the T4 nerve? Before,
Between
between
T4
T4 and T5. Inferior to the T4 vertebra. Between T4 and T5. Where is the emerging side of L3?
3 and 4.
Between L3 and L4 vertebrae. Is it clear?
Yes.
But if I ask you, where is the emerging side of the C6? Between C5 and C6. Is it clear?
Yes.
I told you inferior border of the spinal cord is at the level of intervertebral disc between L1 and L2. It shows spinal cord segments are not at the level of vertebrae, same vertebrae. Because spinal cord is shorter than vertebral column. If you want to know which vertebrae and which spinal cord segment are related together, okay? You should write this. Here is vertebrae, and here is spinal cord segments. For the cervical vertebrae, you should add 1 plus 1. If I ask you which spinal cord segment is located at the level of, for example, C5 vertebra, C6. Okay? Is it clear?
Yes.
From T1 to T6 vertebrae, you should add plus 2. If I ask you which spinal cord segment is at the level of, for example, T5, answer me, T7 spinal cord segments. Is it clear? Yeah? From T7 to T9, add plus 3. Okay? Plus,
What is the reason behind this?
reason, I will tell. plus 3. At the level of T10 vertebra, there is L1 spinal cord segment. T11, L2 and L3 segments. T12, L4 and L5 segments. And at the level of L1, sacral and coccygeal segments. At the beginning of this session, I asked you, there is a patient that it has loss of pain and temperature on the left lower limb and loss of discriminative touch and vibration and motor function on the right lower limb. I asked you which part of the vertebral column has damaged. Which one? No, no. You.
L1 to S3.
When I tell you there is loss of a motor function and sensory function of the lower limb, you know that there is damage from L1 to S3. Yeah? L1 is at the level of T10. L1 is at the level of T10. Is it clear?
Yes.
Okay? After car accident, you see the radiograph of the vertebral column or CT scan of the vertebral column. And you see there is fracture in the T10 vertebra. Okay? You know that? From L1, inferior to the L1 segment, there is damage. If your colleague asks you, what's your opinion about this patient? You answer, maybe he or she will be paralysis in the lower limb because fracture is at the level of T10. And at the level of T10, there is L1 segment. And L1 segment is related to the innervation of the lower limb. Is it clear?
Yes.
This is very important for you. Okay.
When we want to collect the hairs from exoskeleton, we should just add one for all vertebra, or we also make like this. Like when I have, you told me the pair of S or like L5. From where is it exists?
From inferior to the L5
L5. The
vertebra.
pairs, L5 pairs
Yeah.
of nerves.
Two pairs,
Okay.
two nerves emerge from one segment that is called L5. Okay?
Yeah.
These nerves descend in the vertebral canal and emerge inferior to the S5 or L5 vertebra on each side.
Okay.
Is it clear or no? See here. This is listen please. Here is conus medullaris, yeah? And these fibers are coda equina. These fibers are nerve fibers that emerge from lumbar and sacral segments of the spinal cord, descend and then go out on both sides. You see here, yeah, on both sides. Inferior to the same number vertebra. For example, if this is L5, this nerve is L5.
Okay, between L5 and C, S1.
S1.
Yes,
Yeah.
this is the pair. But the segment is returned to,
Segment is one.
yeah, L1.
Single. Single. Segment is single. But nerves are
Pairs.
pair.
And pairs refer to segment.
Yeah,
Yeah.
The same number.
Yeah. yeah. Is it clear?
Yes.
Okay. You don't have attention. You don't have attention.
Doctor, if I could ask a question. If damage to L2 and then the rest, will there be any damage to nerves?
Nerves?
Yes, because here.
Yes, there are many damage to the nerves or to the spinal cord segments. But spinal cord segment is very, very dangerous. When one nerve has damage, there is a local innervation loss for one muscle or sensation. But when spinal cord damage, all nerves inferior to the damage will be damaged and paralysis. Okay?
If the person uses motor innervation but still feels touch, does that mean the muscle died?
I will tell. Be patient, I will tell.
If we have at the same times motor and sensory signal, so we'll come together in the same road of the
I will
same.
tell. Be patient. Okay. From each segment of the spinal cord, two spinal nerves emerge. Each spinal nerve has one anterior or motor root, and one posterior or sensory root. In the motor or in the sensory or posterior or dorsal root, there is a ganglion. What's the meaning of ganglion? Aggregation of cell body of neurons in the PNS is called ganglion. Aggregation of cell body of neurons in the PNS. It's called ganglion. Aggregation or collection of cell body of neurons in the CNS is called gray matter. Gray matter. Okay? Aggregation of cell body of neurons in the CNS is called,
Isn't it called nucleus?
in the CNS, it's called gray matter.
Isn't it called nucleus?
What?
Isn't it called nucleus?
I will tell. collection of cell body of neurons in the CNS is
Gray matter.
gray matter. Okay? In the PNS is ganglion. Okay? But collection of cell body of neurons in the CNS for a specific function is called nucleus. Nucleus is aggregation of cell body of neurons in the CNS for a specific function. Is it clear?
Yes.
No?
I didn't get it.
What?
So gray matter is cell body general.
Generally,
Okay.
location of cell body of neurons in the CNS is called gray matter.
But if it's specific,
But aggregation of cell body of neurons in the CNS, the white matter or gray matter, both of them, for a specific function is called nucleus. No?
So, white matter, what is?
Collection of myelinated fibers in the CNS is called white matter. Collection of myelinated fibers in the CNS is called white matter. What's white matter? Collection of? No. White matter.
Myelinated.
Collection of? Collection of? Collection of what? You, sister. You. Yeah? Collection of myelinated fibers in the CNS is called white matter. Collection of myelinated fibers in the CNS is called white matter. Tell me again. No, no. Myelinated. Yeah. Collection of myelinated fibers in the CNS is called white matter. Collection of cell body of neurons in the CNS, gray matter. Collection of cell body of neurons in the PNS is called ganglion. And collection of cell body of neurons in the CNS for a specific function, nucleus. Is it clear?
Yes.
How many nucleus are there? Nucleus, how many nucleus are there?
Nucleus,
Yes.
there are more than 100. 12? Why you tell me 12?
no, there's something about
No. There are many nuclei. Many nuclei in the CNS. I will tell some of them. Is it clear?
Yes.
Each spinal nerve has two roots. Motor root or anterior root and sensory root or posterior. In the posterior root or sensory root, there is a ganglion that is called dorsal root ganglion, DRG. Dorsal root ganglion or DRG. Okay? DRG or dorsal root ganglion. In the DRG or dorsal root ganglion, there are pseudo-unipolar neurons. Pseudo-unipolar neurons.
Two axes. Two axes.
One round cell body, single process, and
Two
this
axes.
single process divides into two branches. Here is a spinal cord. Here is one segment, here is another segment, and another segment. Yeah? Each segment has two spinal nerves. And each spinal nerve has one anterior motor root and posterior sensory root. In the posterior sensory root, there is
Ganglion.
DRG or dorsal root ganglion. And you see here intervertebral foramina. Intervertebral foramen is the emerging side of the spinal nerve. Is it clear?
Yes.
If I ask you, where is emerging side of the C1 nerve?
Between C1 and
Between occipital and atlas bones. Where is emerging side of the C2?
Between C1 and
Between
C2.
atlas and axis vertebrae. And C8 nerve emerges between C5 and T1 vertebrae. C7 and T1 vertebrae. I told you each spinal nerve has one anterior motor root and one posterior sensory root. First, C1 and coccygeal spinal nerves don't have a dorsal or sensory root. If I ask you, C1 is motor, sensory, or mix, you answer me? Motor.
Motor.
Coccygeal nerve is completely motor. Okay? Because they don't have sensory or posterior root. One part of the skin that has sensory innervation by one spinal nerve is called dermatom. Dermatom. You see here, dermatomes. T2, T1, T3, T4, T6 is at the level of xiphoid process, T10 is at the level of umbilicus. Okay? You see? These are dermatomes. A part of the skin that is innervated by a single spinal nerve. And a part of the muscle that is innervated by a motor nerve is called myotome. You see here dermatomes. Here is umbilicus, and around the umbilicus, this part is innervated by T10. similar to the brain, there are three meninges. Dura mater is dense, irregular connective tissue that around the brain attached to the skull, but around the spinal cord, there is space between vertebrae and dura mater that is called epidural space. Epidural space. Epidural space is filled by loose connective tissue and adipose tissue and many veins. Inside of the dura mater, here is dura mater. Inside of the dura mater there is arachnoid. Arachnoid is an avascular connective tissue without any vessels
Is the first layer?
attached to the dura mater. Okay? External layer is dura mater. And inside of the dura mater there is arachnoid. And third layer is pia mater. Third layer or pia mater attached to the spinal cord and brain. Attached to the brain and spinal cord. Between arachnoid and pia mater, there is a space that is called subarachnoid space. Subarachnoid space. Subarachnoid space is filled by CSF, cerebrospinal fluid. Cerebrospinal fluid is a yellowish germ-free fluid. Germ-free, without any bacteria, any living organisms. Okay? Germ-free, yellowish fluid. The volume of the cerebrospinal fluid is 135 to 150 milliliter. Okay? You see here, dura mater, arachnoid, and pia mater. Between dura mater and vertebra, this cavity is called, this space is called epidural space. Epidural space. This is pia mater that attached to the spinal cord. Between emerging side of the spinal nerves, there are many processes from the pia mater that are called denticulate ligaments. Denticulate ligaments. Triangular lateral extensions of the pia mater. They function to provide stability to the spinal cord within the vertebral canal, and they are 21 pairs for establishment of the spinal cord. I told you in the inferior one-third of the vertebral canal, there is coda equina and filum terminal. Filum terminal is a part of the pia mater, extension of the pia mater. And coda equina are spinal nerves. Yeah? You see here, conus medullaris and filum terminal. in this picture, coda equina removed. You cannot see coda equina because they are removed. This space inferior to the conus medullaris from L1 to S2 is formed by dura mater and arachnoid. This cavity is called lumbar cistern. Lumbar cistern. If you remember, I told you in the subarachnoid space there is cerebrospinal fluid, CSF. Yeah? And here is coda equina and filum terminal and CSF. This side is a very good side for lumbar puncture. Why? Because there isn't spinal cord here. There are many cerebrospinal fluid and the spinous processes of the lumbar vertebrae are short and quadrangular. Okay? This is very good site for lumbar puncture between L3 and L4. Now L4 and L5 is very good area for LP, lumbar puncture.
Between L2 and L3?
L3 and L4 or L4 and L5. I told you a spinal cord is a cylindrical structure, such as this. Yeah? This is a cylindrical structure. You imagine this is a spinal cord. Can I divide conventionally this cylindrical structure to the anterior, posterior, and lateral walls? Yes?
Yes.
I can. I can tell it has anterior surface, posterior surface,
Lateral.
and two lateral surfaces.
BCL.
Yeah? It's possible. In the anterior surface of the spinal cord, there is a deep sulcus that is called anterior median fissure. When I tell you fissure is deeper than sulcus. Fissure is deeper than sulcus. Is it clear? Anterior median fissure is in the midline of the anterior surface of the spinal cord. There is anterior median fissure. On each side of the anterior surface, between anterior and lateral surface on each side, there is anterolateral sulcus. Anterolateral sulcus.
Fissure. Anterolateral fissure.
No, anterolateral sulcus is correct. Just fissure is here. Okay? It's not correct. It's incorrect. This is anterior median fissure.
Excuse me, what is the location of anterolateral surface?
I will tell. This is anterior median fissure. Between anterior surface and lateral surface on each side, there is anterolateral sulcus. Anterior root or motor root of the spinal nerve emerges from anterolateral sulcus. Okay? Okay? Okay. On the posterior surface of the spinal cord, there is a sulcus in the midline that is called posterior median sulcus. Posterior median sulcus. And on each side, between posterior surface and lateral surface, there is posterolateral sulcus on each side. Dorsal or sensory root of the spinal nerve enters into the spinal cord via posterolateral sulcus. Okay?
You said a motor nerve emerges from anterolateral sulcus or region.
Anterolateral sulcus.
And posterolateral also sulcus. Anterior
Yeah.
and posterior is feature.
Yeah. Anterolateral is emerging side for anterior root. And posterolateral sulcus entering what? Sensory. Is it clear? In all cervical segments, and upper six thoracic segments, okay, in all cervical segments and upper six thoracic segments, between posterior median sulcus and posterolateral sulcus, there is another sulcus that is called posterior intermediate sulcus. Okay? If I ask you, anterior median fissure or anterolateral sulcus or posterolateral sulcus or posterior median fissure, posterior median sulcus, is located in which part of the spinal cord? You answer me? Whole length. Yeah? You answer me? Whole length of the spinal cord. But if I ask you, where is the location of posterior intermediate sulcus?
Here cervical and
From C1 to
upper
T6.
six there.
Yeah. Whole length of the cervical spinal cord and upper six segments of the thoracic spinal cord. Is it clear?
Yes.
What's his name? Again.
Posterior intermediate sulcus. Posterior intermediate sulcus. Okay? Is it clear?
Yes.
Okay.
Excuse me, doctor. What is rule of crossing from this is posterior intermediate? Like posterior lateral and lateral, anterior lateral and posterior lateral. We're crossing the anterior motor and the sensory from the intermediate. What will the crossing?
Crossing.
Yeah, like.
I didn't tell about crossing. I didn't tell about crossing. This is gross appearance, external appearance, not crossing. This is external appearance of the spinal cord. Okay? Do you have any question?
No.
After 10 minutes, just 10 minutes, okay? Just 10 minutes.